Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi, everyone. I don't know if you recall, Dr. Marshall, I assisted a Q&A a while ago, and I was having trouble with exercise, and we weren't sure if it was really the exercise or if it was the neck or something, and you also had recommended I go see Dr. Patrick Benjamin.
Oh, yeah.
So he did the complete screen, like for all the concussion, like visual, vestibular, all that. And so initially I kind of passed the VOR screen with like some mild symptoms, but like barely detectable. And then he started working on my neck. And then I came back one session. I was like, I really have this thing where like I kind of have like this like a something in my throat, almost like if my gag reflex is wanting to be activated, but not completely to the point where I want to throw up, just like a little, and um, and then I have like this pain on the right side of my head. And I said it happens like when I scroll on my phone, or when I'm scrolling on the computer or reading and stuff like that. So then he did this thing where this like the smooth pursuits, I think, with like the white and red scarf, and like he did that, and then it completely killed me. Um, so then he tried to give me some exercises, but it was too much. So then we kind of scaled back, and he worked on my neck a little bit, and then he gave me another visual exercises to do that were not as stimulating, maybe. So it was okay. Um, and I also redid the Buffalo concussion treadmill test, and he does it with somebody that's not in his clinic, and then they give him the results. So I don't have the results, but like from my understanding of everything, I passed. Like I didn't have any increase of symptoms other than what appeared to be like cervicogenic tension, like something in my head going on, but like nothing else. Like, and it was no major increase. So I passed. So whatever was happening on the bicycle before was not related to exercise intolerance. It must have been the neck. Now, after we're working on my neck, it's just like I have so much trouble at work, like trying to, read or write or whatever. Like I just keep getting that kind of like ball in my throat and that pain on the right side of my head. Um, so I'm not sure, is it just because like is it the visual exercises are too much, because like I do them and they don't give me any symptoms in at all, like during, and I'm like slowly increasing them, but like I still have no symptoms, and then everything's fine, and then I start to work, and like after an hour, like I'm just like, ugh, you know, which was not my case, like let's say 2 months ago, so I'm just kind of confused. Um, Like, is it because the eye exercises are too much in conjunction with the work? Also, like now, since I passed the exercise, the treadmill test, like I'm starting to do just like light exercise in the morning. Uh, and I'm also only doing like 10 minutes because I know, like, even though I pass, like, I don't want to do like half an hour and then I'm just going to be like exhausted for the rest of the day or something. So I'm just like trying to do it slow. So I don't know, it's because I'm doing the exercise and it's causing me to have something flare up in my neck that's causing my eyes to have more problem, like, or is it the neck treatment? Uh, I don't know if you have any advice, basically.
It's hard to say what the one thing is that is driving this. Typically, like swallowing problems and that type of stuff can be like anxiety related. So, you have to consider that can be a factor. Also, it could be related to just tension in the front of the neck. So is he working on like deep neck flexors and SCM and that type of stuff in the front?
Yeah.
Okay. So, I mean, there could be something there. It could be that after treatment, sometimes you do get some, like reaction to it. Like if you get a really
Mhm.
good deep massage, you're going to be sore after, and that can cause like a little bit of local inflammation around that area. So it could just be a response to that. Um, that's all, you know, fine. Um, then the question is, okay, well, are the eye exercises too much combined with what you're doing at work? So you may want to just try playing with that variable. You might be like, okay, I'm just going to stop doing the eye exercises for a bit. I'm going to continue getting my neck treatment and then just go to work and see, do I have more capacity? Because if you think about it, if you have, let's use like the pacing points system. You have a certain number of points allocated for the day, right? And before, when you weren't doing the eye exercises, you could get through your workload because let's say your day of work is 10 points. But then you add in the eye exercises, which is another 10 points, and now all of a sudden you're blowing capacity. And what's the issue? Well, I don't know. So you just got to try and play with the variables, right? So exercise, not an issue. Great. If I were you, I would encourage you to build up your capacity every week. So don't just say, okay, 10 minutes is all I'm going to do because I don't want to be exhausted for the day. 10 minutes is fine for week one. Then you should move to 12 minutes. And you should just gradually increase that because the goal is to get, 30 minutes of moderate intensity exercise that, you know, does some things. You don't want to just be like, minimal. Um, and then in terms of eye exercises, you can try just saying, okay, I'm just going to cut these down or pare these back and see how I respond at work. Do I have more capacity at work now when I'm not doing these exercises? If that's the case, then okay, let's just stick with work for a bit. Then let's maybe start adding in one or two exercises. You know what I mean? Just little bits to increase your capacity over time, right? Like how many eye exercises are you doing right now?
I'm just doing it's just two. It's like he gave me this piece of paper with like this checkerboard on it and a point in the middle, and I just do the side to side and the up and down
Okay, so you're just doing some VOR. How often are you doing that?
every day.
How many times per day?
Um, I was doing them twice, but I scaled back to once because I was like, maybe that's what it is. But I don't seem to have responded well to scaling it back to once, so I don't know.
Yeah, because this is going to activate your neck. It's also going to activate
Yeah.
vestibular and your oculomotor, your VOR reflex. Um, so I wouldn't think that doing it like once a day is going to really add much to the picture. Um, so yeah,
Well, I was doing it three times a day, and then I scaled it back to two, and now one. But anyways, I see him tonight, so I'll speak to him about that tonight. Yeah.
I mean it's so multifactorial, right? Like fatigue and energy can be related to higher
Yeah.
levels of anxiety, right? If
But
you're
like my energy is totally fine. I have no problems with my energy. It's just the pain,
what pain?
like in my head, that it's literally like it starts from the back of my neck all the way up to my eye, and then sometimes even in my face, like my goes down my nose and then around my cheek.
So it
And
still
then
sounds
I have that ball in my throat, like, and I know that the ball in the throat is like an anxiety thing, but like it almost feels as if the ball is on a specific side. Like that's why I'm like, it's not like, oh, you have that feeling when you're anxious, like that you have, but maybe
yeah.
it is subconscious. I don't know, like,
Oh, it still sounds very neck related to me. So just keep kind of getting the treatment, figuring out like, okay, what's missing here. Sometimes it's peeling back layers of the onion. Like sometimes you'll start with one form of pain, and as you get treatment, it switches to a different spot because you're changing things up. So it's just a bit of a process. I don't think that adding in one, VOR per day is going to do much in terms of aggravating things. If anything, it'll help to kind of keep things loose. And so I would just keep kind of doing what you're doing and let Patrick figure out, where this is coming from. When he treats you, is he able to recreate that headache pain?
sometimes.
Because like basically the treatment when I'm treating somebody, I'm trying to figure out, okay, if I push here, does that cause the headaches and pain that you're feeling?
Well,
And
he
oh,
keeps asking me, and but it's hard. It seems difficult to reproduce. Like, where is it coming from? Like, it seems to be the SCM a lot, but he says like it's improving in terms of like tightness. It's not as tight as it was,
yeah.
but the pain is worse now. So I don't know what's going on.
Yeah, so it's one of those things like you work on the neck, when your eyes move, it activates the neck. So there's still some dysfunction there. So when your eyes are moving and you're scrolling and doing things at work, it's going to just, cause those areas of the neck and then you're going to get the pain. Right? So it's peeling back the layers of the onion, and sometimes it takes a little bit to get into the depth that you need to get to the issue that's there. So I think you're on the right track. Just keep kind of sticking with that. And don't be too concerned about the symptoms. Like that's just a sign that okay, there's still some neck dysfunction. I just need more treatment. Like don't get too caught up in thinking like, oh, something's really wrong. I don't think that's the case. Just neck dysfunction.
I'm trying to not do the something is wrong because I'm trying to not, the whole like your nervous system is more hyper
Right.
vigilant if you think there's a problem kind of thing. So
Right.
I'm working on that.
Yeah, and then continue working on, breathing exercises and the stuff from Melinda's module to try and keep things balanced. Keep working on diet and inflammation because that has a huge influence on neck tension and joint inflammation and things that can cause those symptoms. So just stay diligent on the diet. Try to do things that bring you calmness and bring the nervous system down. When at work, try to take frequent breaks to just break up the, sitting all day. Just try to get up, walk around every 20 minutes, do a little bit of like pull your shoulders back and down, those types of things. That can just help to kind of reset things.
Yeah, I do those things. Um, and also, this is not a question, but just I thought it was interesting. He said that you um have a longer leg, like one leg is longer than the other, and he said there was cases where like correcting that could help improve
Yeah,
uh rehabilitation. So I thought that was
yeah, yeah. Especially when things are one-sided, right? I see this all the time. Like um, usually it's not like a true leg length difference. Usually what it is the pelvis is a little bit torqued, and you can easily kind of reset that. Um, and I mean, it'll come back because your muscles are so used to being in a certain position that the first time you do it, you might like a day and then it just snaps back because that's where your muscles are used to being. So that again, it takes a little bit of time to kind of say, no, I want you here. And then your body goes, well, I'm used to being here. And then you go, no, I want you here. And it just takes a little bit of time to kind of work that out. Is he treating your pelvis and SI joints at all?
yes.
Okay, good.
And then the other question is like, in terms of the pain, and now I don't know if you've treated this subject. It's been a while since I finished the modules, but I don't recall. Like, often they'll tell you like I know when you exercise, like if when you do the test, like okay, you can't increase your symptoms more than like 2 points or 3 points or whatever. And like everywhere you go, they'll tell you like your pain symptoms can't increase more than 2 on 10. Like when you're doing something, and like I find that causes anxiety. Like, because at the beginning I was like, but what happens if I have more than 2 on 10? Like, is it the end of the world? So I don't think like that anymore. But it's just like I find it's hard because at some point even Patrick said like, oh yeah, if you're doing the exercises and it's more than 2 on 10, like you can't do that. So um, so I was like, okay, but I just find it's a bit of a anxiety causing point for me.
We're currently in the process of rebuilding the Concussion Fix course. So here's a module on planning and pacing. So basically, there's two types of maladaptive kind of people or strategies, right? Number one
Mhm.
is people that completely avoid any type of symptoms at all. And then the other maladaptive one is people that push too hard into symptoms, being like, yeah, my symptoms are increasing, but I'm just going to push through. I'm just going to push, push, push. Both of those are bad. You want to be kind of in the middle of that because if you think about it this way, if you're doing symptom avoidance, you're staying way down here. And what starts to happen is that this line gets closer and closer so that even less activity now provokes symptoms because you're staying so far below symptom levels that you're getting weaker, right? It's saying
Mhm.
like, I don't want to go to the gym and lift weights if it's going to make me sore the next day. So what you do is you lower the weight so that you're not sore the next day. But guess what? You're now getting weaker even as you're exercising. So it's the same kind of concept. Now, pushing through is here's your line, and now you're going way up into severe symptoms before you pull back, or you're just saying, I'm just going to push through. What happens in this scenario is that your body goes into kind of fight or flight mode, and now it goes into like full blown like protection safety, and you have a crash. And then now you're in this situation where now your line is down again, right? So this would be akin to going to the gym and being like, I'm going to lift so heavy that I injure myself. Right? Now I can't lift at all because now I have to recover from a muscle tear because I went too crazy. Right? So what you want to do is this, where you want to push in to symptoms. You don't want to avoid symptoms. You want to push into symptoms. But once they start creeping up a bit, some people say 2, some people say 3. Like when I'm having people do vestibular rehab, I say go until your symptoms hit like a 5 out of 10. And then stop, let things calm down, do it again. And then get to a 5 out of 10, pull back. So that you're not getting into the severe range of like, oh my God, I've debilitated myself. But you're pushing into those symptoms and then you're going, okay, it's time for a break. Right? You're sitting at your computer, headache's starting to increase. Okay, hitting about a 3 out of 10. All right, I'm going to go grab a water, go to the washroom, walk around, do some stretches, go sit somewhere quietly, just close my eyes, just relax for a bit, things calm down. And then I'm going to go back to it. Okay, things are creeping up again, getting a little bit sore. You might even do some self kind of massage on some areas to see if that can alleviate, right? But you want to just be pushing in, then pulling back, pushing in, pulling back, pushing in, pulling back. Because then what happens is that line gets further and further away. So it takes more now to cause the symptom increase. And now you're building capacity in a safe way without risking the setback that comes with overdoing it. And you're also not risking letting things come to you because you're being so cautious, right? So not to let it provoke anxiety, just in mind, be like, okay, my symptoms are starting to creep up a bit. That's okay. It's only up like 1 or 2. I can keep going. But now it's at a 3 or a 4. Yeah, you know what? I'm going to take a break now.
And I think like that's kind of what I've been doing. It's just like now that pain seems something is obviously aggravated because now it's like I'll start working and it'll come up and it's not like all of a sudden boom, it's a 8 out of 10. It's just like okay, it's coming and I'll do my usual like okay, take a break.
Yeah.
But then like I'll come back and it's right away back, like it's just always there the second I start using my eyes,
Yeah.
So
So I think again that's just like neck issues that need to be worked out. So do what you can, try to stay within that kind of peak valley type scenario, that Goldilocks zone. And yeah, just keep getting the neck work and keep kind of being diligent on the other foundational pieces and, keep doing things to calm the nervous system down a bit. And yeah, like you'll get there. So it's just kind of just time and patience at this point. You're doing all the right things. Just stick with the plan and try not to, add increased anxiety to it.
mm-hmm. Okay, thank you.
You're welcome. Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.